Well, dental implants are becoming more and more common, and the technology has gotten so advanced and better for the patient with these. They're great. They're the best thing. If you're missing a tooth, the best thing you can do is an implant. One implant replaces one tooth. So the implant is basically a metal post that goes into your jaw. And I like to use the analogy of like, when you put up a fence in your backyard, the fence post has to set up in the cement around that post before you can put up the whole fence. If you try to put up the fence on the fence post before that cement has set up, the fence is just going to collapse. So the implant is first placed into your bone, and the bone has to heal around it. Sometimes a bone graft is needed, but it's soft, so it takes 6 months or so for the bone to fully heal around that before we can actually put a tooth on top of that. So once the bone is all healed and everything, we put in the top part of the implant, and then the crown goes right on top. So there's actually 3 parts to the implant, but they are very, very well tolerated by the patient. They're strong. It feels like you have your own tooth back again. You don't have to drill down the teeth next to the implant to make a bridge or anything like that. You're just working on the one tooth where the space is. It's very, very good. What kind of patients are the best candidates for implants? Anyone that's healthy, really. The only medical conditions that would contraindicate getting an implant are, if you're a smoker, that's not good. Your blood vessels aren't healthy, your healing's not gonna be healthy. Long term, your gums won't be healthy if you're a smoker. That's one thing you should not be doing. You should be a smoker if you're gonna get implants. Having diabetes, another thing that makes healing slow, and healing around an implant wouldn't be good. So smoking and diabetes, you should probably get those under control or rethink that option if you're thinking about implants. Do implants last forever? Well, they last a lot longer than a bridge, and I don't ever say anything lasts forever in the oral condition. Many things can happen. You could get diabetes down the road or such and such. They do need to be maintained. You need to come in every 6 months to have them looked at. Sometimes they need to have a little bit of tightening. You could still build up tartar on an implant. You need to have the implants clean. So it's really important too just to check your bite every 6 months, because we want to make sure you're not biting too heavy on the implant. We can't put a lot of force on the implant. The force has to be even around all your teeth in your mouth. And that's something we need to check at your appointments when you come in. A bite guard is good to have, an occlusal guard to wear over your mouth at night, because every time you swallow, your teeth come together, and that's hitting. Your teeth are hitting together, and we don't want to be putting too much pressure on the implant itself.